Joe Magnant. Welcome to Vein Specialist. We're going to do our virtual educational lecture tonight. Coming to you live from my office. I just finished doing a few procedures. Behind me, you'll see a slideshow playing as I'm talking to you. And there's just some example images of patients we've taken care of in the past with venous disease. So what today's sort of mini lecture is going to be about is vein disease. It's something that affects about 50 million adult Americans in the United States. And it's something near and dear to my heart as a vascular surgeon. I changed from doing artery surgery up until 2006 to move to Fort Myers to open up a vein practice, vein specialist, to focus 100% of my attention on venous disease. And the reason I was able to do that was because up until the year 2000, all we had to offer patients with vein disease was vein stripping, which was very invasive. It was done in the hospital under general anesthesia and required a long recovery. So not many people really were crazy about having a vein strip, and we rarely offered it. So in 2000, the technology of endovenous ablation was introduced and allowed us at that time to start treating patients through needle sticks with catheters in the office under local anesthesia, which was much safer, much more effective, and much more accepted by patients. And since that time, now 20 years, this year is the 20th anniversary for the introduction and the approval of endovenous ablation, sealing techniques for treating varicose veins and other venous disease since its introduction and approval by the FDA. So let's talk about what is venous disease. I mean, venous disease, everybody knows what varicose veins are venous disease, but there are other presentations of venous disease or venous insufficiency other than varicose veins. Like today I took care of a few patients with swollen legs. I had a few other patients who had rashes on their legs down around their ankles that were being treated by dermatologists. And these astute dermatologists recognized this dermatitis as stasis dermatitis related to underlying venous insufficiency. So venous disease is much more than just varicose veins. It's swollen legs in some cases. It's skin changes or discolored skin around the lower legs, which can progress to the point of becoming thickened and hardened and actually ulcerate if traumatized or if biopsy. And then other than the signs, those are physical signs which you can see, there are other patients who just have symptoms of vein disease. Nighttime leg cramps or Charlie horses, or nighttime urination, or restless leg syndrome. So it's not always varicose veins, it's not always something you can see, but maybe it's something you can feel or something that you have been feeling. So I call the nighttime triad restless legs, nighttime leg cramps and Charlie horses, and nighttime urination. Those are the three things that make up the nighttime symptoms of venous disease. Fatigued legs, heavy legs, as the day goes on especially, all are symptoms of venous disease. So there's signs which you can see physically, and then there's symptoms what patients feel, and then some patients may have both. So venous disease encompasses a large population of patients with a variety of presentations. The risk factors for venous insufficiency, I think, are worth talking about too. The number one risk factor for developing venous insufficiency is genetics. Look at your mother, father, grandmother, grandfather. I mean, it's pretty simple to see that if your mother has varicose veins, you have a significant chance of developing varicose veins or venous disease in the future. Other things such as pregnancies, multiple pregnancies, central obesity, belly weight, standing or sitting occupations, advancing age, history of a blood clot in your leg, all of those things are risk factors for venous disease. What do you do about it if you do have it? What can be done for it? Well, the treatment, as I mentioned earlier, is endovenous ablation, or sealing of the veins from within. We don't just jump from your appointment, new patient appointment, to a procedure. We do an evaluation, a physical examination, a thorough history taken in the office as a new patient appointment, and then most of our patients will need an ultrasound. And the ultrasound, I think, is probably the critical step in terms of the diagnosis. It shows us which veins are leaking,
how badly they're leaking, how long this segment is leaking, how many veins are leaking in each leg. So it gives us a roadmap, and then we can decide specific treatments for each leg in terms of numbers of veins and which veins to treat. All treatments are performed in the office, in our office. We have 2 sterile operating rooms here in the Fort Myers office and the same in our Bonita Springs office, which really serves Bonita Springs and Naples. I'll say why choose vein specialist? Vein specialist has 2 accredited vein centers, 2 accredited vascular labs, and we are the oldest accredited vein centers in the state of Florida, but we were the first in Southwest Florida. I'm a board certified vascular surgeon. I do work with other providers. We have 4 advanced registered nurse practitioners who do most of the new patient evaluations and most of the follow-ups. We have 6 registered vascular sonographers, both throughout, between here and the Bonita Springs office, and then we probably have 8 or 10 medical assistants. We have a staff of concierge, patient representatives to check in, check out, surgery schedulers. There's 38 staff in vein specialists organization, and we look forward to evaluating you and seeing what we can do to help you. Thank you.